Ghana's healthcare system is facing a crisis. There just aren't enough experienced nurses.
Is it right for you to just finish your national service and decide that you are leaving?
The country trains plenty, but then they leave for better salaries abroad.
It's affecting the staff.
I've seen quite a number of my nurses leave on a monthly basis, and it's quite devastating.
Dr. Kennedy Bryson doesn't blame his registered nurses for seeking opportunity abroad, but he is critical of countries that take those nurses and do nothing for Ghana.
So Canada is benefiting tremendously. The United States is benefiting. UK is benefiting. But those of us who are doing the training are not benefiting. Amy just left. I think she got to Canada. Is it Canada?
Last year, 7,000 of Ghana's nurses left for wealthier nations, but the brain drain has got even worse this year. In just the first 6 months of 2023, 5,200 departed. Most of them had been trained in the public system.
It's not a fair deal that is going on.
It's like Ghana, the head of the Nurses Association says, is subsidizing countries like Canada.
I think it's about time these countries actually approach Ghana and go into some formal bilateral arrangements so that if we package nurses from Ghana and bring them to Canada, for example, Canada should be able to support Ghana's training.
Notice that she isn't saying nurses shouldn't go. She says that is their right, especially when the average wage for a nurse here is around $300 a month.
Could you buy a house on a Ghana nurse's salary?
That would be really, really difficult.
You're looking to move abroad?
Yes, that's the plan.
To Canada?
Yes, that's the plan.
And where?
Well, now I'm looking to relocate to Alberta.
Alberta?
Yes. I submitted in my application in February, but
Festus Frimpong could be there by the end of the year, lured by a better salary and a provincial offer to pay the first 3 months of his accommodation. It'll help support his extended family back in Ghana, but he worries about the co-workers and patients he'll leave behind.
This is difficult. I mean, this is home, so we have a lot of nurses and midwives living, and then most of whom are the experienced ones. So then the question we ask is, what's going to happen in Ghana in the next 2 or 3 years?
They have their human rights to travel across the world and decide where to ply their trade. But the ordinary Ghanaian also has a right to be seen and treated when he or she is sick.
The message from Ghana is not stop stealing our nurses, it's pay us to offset Ghana's costs to produce nurses for countries like Canada. It shows the domino effect of the nurse staffing crisis around the world.